Thanks for being with us here on Morning Live. Now, French President Emmanuel Macron has called for 4 to 5% of COVID-19 vaccine stocks in Europe to be made available to African countries and others globally who are unable to afford them. And in addition, they have also contributed towards the Covax vaccine facility and also have said that they would like to assist South Africa in producing its own vaccines. So to discuss this in a little more detail, we're joined by the French ambassador to South Africa, Aurélien Lechevallier. Thanks so much for your time, Ambassador. Welcome to Morning Live.
Thank you very much. It's great to be back on Morning Live.
So, Ambassador, some in the EU have been very vocal in saying that only once Europe has had their fair share of the vaccine, then only will it be prudent to assist others. But France, of course, has now called for about 4 to 5% of the existing stock of vaccines to be made available to African and other countries who are unable to secure vaccines. What's the rationale behind this? And also, how has this juxtaposition been met by fellow members of the European Union?
Well, thank you very much. I think as a whole, the European Union has been very supportive of an international solidarity mechanism from the start. And actually, the Covax international mechanism has been supported and funded by the European Union. So the idea is really to provide all the countries all around the globe with vaccines thanks to this international mechanism. And this is well underway. We are waiting for the first vaccines to be delivered in the coming days and weeks. It has started actually in Côte d'Ivoire and Ghana since last week. But now, if we are speaking about the existing stocks negotiated by the European Union members themselves, it's true that French president would like to go a little bit faster and make sure that at least 3 or 5% of these vaccines can be also delivered to the countries in need to accelerate the process.
And of course, the logic one would imagine the world over at a time like this when we all are dealing with a common enemy would be to slow down the spread of the pandemic and thereby making sure that, we don't get stuck on things like vaccine nationalism. And there's quite a lot of talk that has been had and many pronouncements being made even by the World Health Organization about vaccine equity. So just with regard to that, when we do see richer nations hoarding and making sure that they are taken care of first, what does this mean for the rest of the world in terms of slowing down the virus, especially when we have new variants coming about?
Yeah, well, you're absolutely right in terms of the overall objective is to have an equitable access to vaccines for everybody. I think there are different players here at stake. The pharmaceutical companies, they work very hard to make the vaccines, but they are also private companies, so they are waiting for return on investment. That's quite logical, and that's also the reason why the countries, including South Africa, including France and other partners, have created this international mechanism to negotiate collectively. And I think it's the only way to generate some equitable access and a good quality of the product and also high transparency in the prices of the product. Because if each country negotiates its own vaccines on a case-by-case basis, then the prices, of course, will be absolutely huge. So this is what we're trying to do. Obviously, there are some delays, but now I think we are catching up, and each country is also trying to diversify the sources of supply from the different vaccines. But I'm pretty confident that the Covax international mechanism will play a decisive role in Africa and in South Africa, as President Ramaphosa mentioned last night during his speech.
And of course, Ambassador, as you point out, and rightly so, the importance of the Covax facility. But, some would argue that as it stands right now, it does seem very much that some countries are all for themselves. And the EU, however, is producing and procuring vaccines as a collective, as a bloc. So talk to us more about how Europe is currently managing their vaccine rollout.
Well, there is a priority for, the health workers and the elderly and the vulnerable people and communities, like in South Africa. So far, we've been able to provide vaccines to almost 6%, I think, of our European population. So the rollout campaign is well underway, and the good breakthrough, if I may say, is that we have managed to negotiate collectively with the pharmaceutical companies. And that's very important. It was not easy, of course, because as you said, there is always this reflex to this impulse to negotiate directly with the companies, but we've managed to play collectively. And we see that it's exactly what also South Africa is doing, because part of the sources of vaccines will be negotiated with companies, but also a very significant part will be provided through this EU-supported international Covax mechanism and also the African Union mechanism. So I think it's a good strategy, and we are all, trying our best. Of course, there are hurdles, especially with the variants, because not all the vaccines are as efficient with the different variants than the others. But I think that all in all, now we are making a lot of progress together.
Now, Ambassador, France is, of course, a Covax donor country, about 100 million euros donated so far. And we do know that countries have to have plans that are necessary for the rollout of these vaccines before they will even be considered by Covax. But that aside, who actually gets to decide which countries receive these vaccines and at which time? Does France, for example, have a say? Did you have a say in determining that Ghana, for example, would be the first country to receive their Covax allocation for the African continent?
Well, thank you. First, you highlighted something very important, is that now the quantity of the secured doses will not be the largest problem. Nor will be the financial aspect, because I think that every country will secure in its budget, like South Africa, the financing of the doses. The main problem today is the allocating of the distribution of the vaccines, because, of course, we are short of vaccines, and we want to make sure that we optimize this allocation or repartition or distribution of the vaccines. And to answer your question, I think the best possible way is to rely on collective mechanisms again. So we are strong supporters and believers of the World Health Organization and the different international networks such as Gavi and the UN agency like UNICEF. So WHO, UNICEF will decide, and have been decided actually, which country will receive in terms of priority the number of available doses. So last week, for example, Ghana and Côte d'Ivoire received the first Covax doses, and there will be a timeline where all the different countries from now until the end of April will receive also the Covax funded doses. So it's really internationally monitored.
So it would be the UN, United Nations agencies that decide, but do donor countries have any sort of say in that particular decision?
I think you could say, for example, that for France, Africa is a priority. And our two presidents, President Ramaphosa and President Macron, have been talking a lot together since last year to discuss the Covax mechanism, to discuss the international solidarity project, and including recently this idea of providing 3 to 5% of our existing doses also to African countries. So there is a say, but we would like to rely on the international networks to move forward, because we don't want to create some kind of new architecture or network. We have to work with existing mechanisms of distribution on the ground.
And then, Ambassador, the issue of pricing is obviously also quite a crucial one, given that there are very poor nations in this world who may really struggle to even get into any sort of bilateral agreement. Now, France is calling for transparency and regulation of the prices that are currently being charged by pharmaceutical companies in order to avoid exactly that problem where you have higher prices, for example, for those who get on later when there is, as we have at the moment, still a bit of a shortage of vaccines. Is there a concern, though, that poorer countries may be charged more than wealthier countries?
Well, yes, absolutely. I mean, the first concern is the quality. Are we sure that the products that we get are efficient enough to fight against the virus? That's one. Then, of course, the timeline. We all want to get the vaccines as early as possible, and it has started in South Africa. But price is key, because you don't want to pay double the price or triple the price. And we saw, unfortunately, examples of this in the recent weeks, where a few countries, actually a small number of countries, but rushed to negotiate directly with the pharmaceutical companies, and the result was a very high price, like up to 4 times the price that they should have paid thanks to the Covax mechanism. So we really want to accelerate now the delivery of the vaccines through Covax mechanisms, the EU international solidarity tool, and also the African Union new mechanism to make sure that the prices are transparent and that the vulnerable countries are not paying an overprice to negotiate quality and doses that are too expensive.
And have you found that the pharmaceutical companies are amenable to this?
Well, WHO and our governments, we have conveyed many messages asking the pharmaceutical companies to play their part and to play their role. Because as you said, I mean, it's quite a unique situation. It's totally unheard of. We all have to be in this fight together. But obviously, I mean, we understand that private companies invested a lot of money in terms of research and development. They want their return on investment. And well, if you want today to buy a vaccine for tomorrow, let's say, the pharmaceutical company will say that the price must be at that level, But that's why we have to be organized, coordinated, consistent, and patient, so that at the end of the day, the vaccines are all reaching their destination with good quality and affordable prices.
So if we look at the South African situation, for example, dealing with a new variant, and this places us in a very peculiar situation with regard to the procurement. As you are aware, being here in South Africa, the AstraZeneca vaccine that was purchased that then wasn't necessarily as effective as we would have hoped it would be against our variant of the coronavirus. And, France has indicated that they want to assist South Africa. And we know there's a long-standing relationship between the French and South Africa when it comes to science, innovation and technology. But how exactly would France want to assist South Africa to manufacture these vaccines?
No, it's absolutely true. Thank you very much. And we've been partners for a very long time, including for the fighting against HIV, AIDS, TB and malaria. We've been working together a lot, and we want to continue to do so. We saw, of course, that the AstraZeneca results in terms of the variants here in South Africa were a little bit disappointing, at least for the moment. And that's why all the rollout vaccination campaign strategy of the South African government had to be adjusted. And we understood perfectly this. And thankfully, you could secure more doses coming from other companies, including Johnson & Johnson. And actually, these vaccines are made significantly in Europe. So they are coming from Europe, as you know, and they will be also made in South Africa, thanks to a very important South African company called Aspen. And I think that today everybody is focused on the delivery of the COVID vaccines, which is absolutely logical. But there is another big challenge at stake, which is the capacity for the African countries to make their own vaccines. And most of these capacities today are in South Africa, with companies such as Aspen or BioVac, or you have also, top-class international level hospitals, research centers, universities that can also provide a fantastic progress in terms of making your own vaccines. So I think that with other European colleagues, this will be really our next challenge, to work together to make sure that South Africa can become a global maker and global producer of vaccines, not only for COVID-19, but also for all the vaccines that we are fighting against.
And just a final question, Ambassador. Given the current travel restrictions, do we have any citizens stuck in each other's countries? And if so, what are the plans to actually relocate them, get them home as soon as possible?
No, I think we solved that, fortunately, working very hard with our colleagues from the South African Embassy in Paris and DIRCO and the Department of Home Affairs. So now we are waiting for more green lights to be able to travel between our two countries. The decision made by President Ramaphosa and the cabinet announced last night is, of course, a positive development with the coming back to level 1. So we'll see how the situation evolves in Europe. But of course, we are looking forward to more mobility and visitors and tourism and business links coming back. But I must say that, like this morning between you and me, the online work have kept us very busy. So this is good to hear.
Well, Ambassador, thanks so much for your time and speaking to us this morning. The French ambassador to South Africa, Aurélien Lechevallier, talking to us about his country, saying that there needs to be broader spread of COVID-19 vaccines as well, and discussing their interest in assisting South Africa to manufacture vaccines, not just for COVID-19, as you heard him say, but more broadly speaking. So this is where we're going to leave that one. Right.